Good evening. I'm Mayor Ron NIRENBERG with Bexar County Judge Nelson Wolff. We're joined tonight by Dr. Colleen Bridger, and this is our COVID-19 update for the San Antonio community. As of yesterday, as reported by DSHS in Bexar County, there have been 601,272 people who have received their first dose of the vaccine, and 376,814 people who are fully vaccinated. Once a week on Thursdays, we will also have an update on total vaccinations that includes DOD and VA data. So as they do not report their numbers to the state, we'll add those to our totals on a weekly basis so you can get a complete picture of the vaccination process, which is going quite well here in Bexar County. Starting tomorrow, we do want to let you know that people over the age of 70 now are able to go to the Alamo Dome in the afternoons to receive their COVID-19 vaccine without an appointment. We will continue to focus on our priority populations and ensure our community remains healthy. And reminder that you can subscribe to vaccine alerts when appointments become available for registration by texting vaccine or vacuna to 55000. Now, an update on our COVID numbers. Tonight, we're reporting 317 new cases of COVID-19, which brings our total to 210,796. Our 7-day rolling average is up a bit to 232. Our positivity rate now has increased just a bit to 2.4%, but we still remain on the low side. Hope to stay that way. In fact, that 2.4% is the lowest among major metros in Texas. That has continued. Fortunately, we do not have any new deaths to report tonight, but please continue to keep those families who are still mourning loved ones in your prayers this evening. There are 217 COVID-19 patients in our local hospitals this evening. Overnight, there were 33 new admissions within the last 24 hours. 79 patients are in the ICU, and 38 are on ventilators. Let me turn it now to Judge Wolff.
Well, I know everybody's getting a little tired of saying that we need to be careful, but we do. On April the 3rd, we were down to 176 people in the hospital. Today we're up to 217. That means 41 more people in the hospital in the last 9 days. Obviously, you don't go to the hospital unless you're very, very sick. I don't know what the status of the B117 is here, but across the United States, it's becoming the dominant variant of COVID. And it's affecting more young people today, and more of them are ended up in the hospital. And obviously, a lot of them never bothered to get vaccinated. So it's just not the old people now, it's younger people being affected by this. As the mayor said, things are looking good. And vaccines, of course, we're racing as fast as we can to get people vaccinated to try to stop any continuing rise in cases. Last week, we had a record week at the Wonderland Mall and 2 other smaller locations. Last week, the Bexar County Hospital District did 35,899 vaccinations, a huge number for us, of which 1,600 were at St. Philip's and about a couple of hundred more at the Robert B. Greene. The mayor mentioned VA is starting to give shots. In fact, they were opening at the Wonderland Mall today, but we don't know what the status of that is. We'll continue to do about 6,500 a day for this coming week. And what has really helped us, we're getting 20,000 new doses. That's 7,000 more per week that we've got in the last couple of weeks. So it's really beginning to roll out. I think now we've done, through Saturday, 315,529 vaccinations. So we're getting shots in the arm, and the quicker we do that. And I might just add, there's some data out there that shows if you've had COVID before and you think you don't need to worry about anything, the vaccinations are more apt to protect you. Some 9% of people that have COVID do not develop the antibodies for it. So get those shots and let's get this thing over with.
Great. Thank you, Judge. And you might know also our Homebound Senior Program continues as we bring the COVID vaccine to folks who are in their homes and not able to get out to the vaccination sites, whether at their pharmacy or the Dome or the UHS sites. We do have that Homebound program continuing. Now it's time for our frequently asked question of the day, questions that we get often to Metro Health, and I'm going to pose this one to Dr. Bridger. Dr. Bridger, can vaccinated people still spread the COVID-19 virus?
So the short answer is yes, absolutely. Vaccination means that you're less likely to get COVID, but it doesn't mean you won't get COVID. And it also means that if you do get COVID, you'll have a more mild case. And so you do have to be careful, even if you've been vaccinated, if you're around other unvaccinated individuals, to make sure that you continue to wear your mask and practice social distancing.
Thank you, Doc. And I also want to say thank you to the Romo sisters who handmade some masks for the judge and me over the weekend. Thank you to Roxanne, Lisa, and Olga. Again, a reminder that we have to continue to do our part to protect one another. I've been wearing my mask all day, and we'll be doing that this week. So thank you very much to the Romo sisters. Now, you have been hearing about the blood supply issue in our community. I want to close with a special note about this. The blood supply reported by the South Texas Blood and Tissue Center is extremely critical. It's now total in a 1.5 day supply. That's all types. We need to significantly close that gap to reach the 7-day supply recommended for our area. We know that blood orders are outpacing blood donations by about 20% higher than normal, and so we really need you to consider giving blood donations. The type O blood supply, which is used in emergency, is even more critical at less than a half-day supply. An additional 200 donations per day are needed to help rebuild the inventory, so please consider donations today. There are 6 donor rooms available at the South Texas Blood and Tissue Center, as well as at University Hospital. You can give blood there as well by calling 210-358-2812. You can also schedule an appointment at the blood bank by going to southtexasblood.org. Finally, if you need relief and assistance and you're struggling through this pandemic, paying rent or mortgage, please get information about our Emergency Housing Assistance Program by calling 311. Or if you're out of work and without an income and would like to train for a job that's available today while you receive a stipend to make ends meet, you can get information by calling 311 or enroll in our training program at 210-224-HELP. And as always, you can get the latest on COVID-19 by texting COSAGov to 55000 or by going to the website covid19.sanantonio.gov. We're almost there. We can see the light at the end of the tunnel. We've been working together so hard over the last year to put an end to this pandemic. Please continue to do your part. Wear your mask, practice social distancing, proper hygiene. Do it for yourself, do it for your family, and do it for San Antonio. Dr. Bridger, myself, and the judge are available for questions.
Are you all concerned about rising hospitalizations, and what are hospitals telling you right now? What are they seeing inside the hospitals?
Well, we asked the question today. We have daily updates, and we have seen a little bit of a bump in the hospital numbers. We see that from time to time as the overall trend continues to decline. We're watching that very closely. We hope that continues to overall move in the right direction, but there's no doubt about it. There has been a little bit of a bump over the last week in terms of hospital numbers.
Yeah, we've got great capacity now. It's hard to really make any sense whether this is meaningful or not, that we've kind of gone up now 41 in 9 days, but it's probably going to take a little bit longer for us to see if indeed we are going to continue to increase.
What is the latest on the variants? We know that some UK variants were found here. Is there any update on that?
I don't think there's any reason to believe that San Antonio is any different than the rest of the U.S. I think that the variant is becoming a more predominant strain here in San Antonio as it has been across the United States. The good news is that the vaccines are pretty effective against that specific variant, but the best thing is social distancing and wearing your mask.
Have we seen more than the 6 that were reported? Is there an increase?
So, we send off a sample to see if it's here. Once we know it's here, then we're not, we know it's here, right? We're not counting how many of them are here. We just want to see, is it here? Which is why I'm saying it's unlikely we're any different from the rest of the United States.
You answered a similar question about hospitalizations, but here's one. The 7-day average has jumped by almost 70 in a week. Is that concerning?
We're watching that very closely. We don't know if it's a start of even more of an increase, or if this is what we've been expecting to see with the combination of spring break and lifting of the mask order. So, we'll just have to see if we've been able to stay, that half a step ahead with all of the vaccinations that we've been doing. That's my hope. But we'll need another week's worth of data to really better understand that.
Could you provide an update about the status of creating a vaccine registry for Bexar County?
Yes, we are rolling out the public-facing component of that wait list registry on Wednesday, and we'll start to collect names of individuals. We've been doing some trialing of it through 311, so there's a handful of people who are already in the waiting list, but it will go live to all of the public on Wednesday. Again, it's for people 65 and up to start with, and then the HASA programmers will start working on the side that we need to develop to share that data with vaccinators. But starting on Wednesday, people can start signing either themselves up or their loved ones up for that waiting list.
Is the city going to track the vaccination rates for zip codes or council districts, just how they did with COVID-19 deaths?
Yes. Yes, absolutely.
Is that going to be in the next few weeks, or is that already happening right now that you all are doing that?
I know we have it by zip code. We don't include it in the weekly report because that's a lot of information. We are also doing heat maps that are showing up in the weekly report, and those are reflective of districts. So I can give you a hard copy of that report, and we can talk about it. But we have that data.
Governor Abbott says Texas is very close to herd immunity. Are we?
No. We're just not. I think part of the challenge is that people want to think about people who've previously had a COVID infection as a separate group from people who have been vaccinated against COVID. And so if you think 30% of the population has had COVID, and, right now in San Antonio, at least we're right about 25% of the population is fully vaccinated, even if you were to add those two numbers, we wouldn't be close to herd immunity. And that doesn't even recognize the fact that there's a lot of people who've previously had COVID who are also vaccinated. There's no way. We're just not anywhere near herd immunity at this point. And there's some debate about what herd immunity is. I think the best estimate is between 80 and 85% of the population being fully vaccinated, and we're nowhere near that.
I think President Biden said, end of July or sometime in July, so here we are, middle of April, so you still got April, May, June, you still got 3 or 4 months to go before we probably get to that. And that's the reason why we, keep saying, don't let your guard down. This thing is not over with yet. And, we all want it over, and we're all getting tired of hearing that. But it's not over till it's over. Yogi Berra said that, and he's exactly right.
Well, and virtually everything is open. You can do virtually anything you want to do as long as you take the very minor precautions of wearing a mask. And if you're fully vaccinated, great. Help us get other people to the finish line by continuing to do your part. I mean, we're almost there. As the judge said, estimates about 3 or 4 months from now to we can get that critical mass of folks vaccinated. But, what we have to do between now and then is not very hard. It's not.
The other thing I want to add is, as the judge mentioned earlier, there's a proportion of people who have had COVID who'd never develop antibodies. And the other thing to remember is that if a person has had COVID, they lose their immunity much more quickly post-infection than they do post-vaccination. So we really encourage people, even if you've had COVID infection, to be vaccinated against COVID, because that's a much more reliable form of protection than having had the disease.
Critics are saying the governor doesn't even know what the actual definition of herd immunity is. He seems misinformed. Is it damaging when you have a leader of our state appear to be confused?
Well, we've always have not been in tune with the governor. We think a lot of things some of the state officials have been saying contradicts everything that we try to say right here. And certainly taking away the mask mandate was a big one that led to numerous deaths last summer. And we're getting through this one pretty good so far because we have more vaccines. But, you shouldn't declare victory till victory is here, and we're not there yet.
Yeah, and that's why I think the medical experts who have been giving us this information, providing the data virtually every day throughout this pandemic has been our main tool to fight it, regardless of what politics might tell you about what's going on. The medical experts are providing the guidance, and as far as herd immunity goes, you heard it from Dr. Bridger. It's 80 to 85%. We're not anywhere close to that. We are making our good progress towards it, but we're not close to it. The Triple Crown is you got to lead in home runs, RBIs, and hits, right? Batting average. If you don't, then you don't have the Triple Crown. Well, you got to hit 85% for herd immunity. We're not at herd immunity.
Is the city concerned about vaccination hesitancy or people getting comfortable not wearing masks?
Well, it's interesting. I don't know what you've observed, but if I go into a store, everybody has the mask on, whether it's a restaurant or whether it's a grocery store or whatever. Just about everybody has a mask on. But if you go to a social event, it's different. A lot of people do not have the mask on. And let's just say, okay, I've had both my shots, and it's been quite a while ago, and I'm probably about as protected as anybody could be. And you have that tendency to say, well, I took the shot, so I'm going to go and not wear a mask, and I'm not worried about it, even though you could pass it. And then somebody looks at you, and you don't have a mask on, and they don't know whether you had the two shots or not. And then they say, well, if he's not wearing a mask, I'm not going to wear a mask, So I see that more in social gatherings than I do in businesses. Have really been our salvation, to tell you the truth. They've been more cognizant of the danger of it than anybody has, and we're very appreciative of that.
And on the vaccine hesitancy, I would say we are starting to target people who have expressed some vaccine hesitancy. The interesting thing is that this vaccine was probably the most bipartisan vaccine I've ever been familiar with. It was developed under a Republican president. It's being rolled out by a Democrat president. So what we're seeing, though, is some political divisions on who is taking the vaccine and who is not taking the vaccine. It's incredibly safe, and it's the best way for us to get back to normal as quickly as possible. So we're going to really be trying to work to help address any concerns that people have and help people understand just how safe it is and how smart it is to take it.
How will you all be doing that? Is there going to be more information out? You're going to be calling more people, or?
We're going to take a lot of pages out of the COVID-19 testing playbook. So using our peer influencers and using, kind of peer-to-peer communication. I'm probably not the most compelling messenger for, a 20-year-old white male. So let's get somebody who kind of talks the talk and spread that message across the appropriate peers. So we'll be doing that, and then, continuing to run the radio and television and other ads to really target that population.
Based on current vaccination progress, when will Bexar County reach herd immunity?
That's a tough one to project, so I'm going to line up with what President Biden has said, which is that the majority of the country will have reached herd immunity by end of July. So I don't, right now we're exceeding the national average on a number of the vaccine indicators. So I don't see any reason to believe why we wouldn't match up with the rest of the U.S. on that.
Is there a chance we will not reach herd immunity?
Well, you know, when we say this herd immunity, I mean, there's no barriers around a city. Yeah, we may be getting a lot of our people vaccinated, but there's still, you know, thousands of people coming into the city that we don't know whether they've had it or not have it. So herd immunity to me is, you know, a much broader picture than just whether it's San Antonio or whatever. You know, the state, the nation, you got to reach it, I think, nationwide for us all to really be sure that we're doing okay.
You know, and I think sometimes the focus on herd immunity makes it seem so dispassionate and unpersonal. You know, I'm fully vaccinated, and I am really excited about the fact that I'm going to go hug my mom for the first time since the pandemic started for Mother's Day. So, you know, think about what it means to be vaccinated, not just for you, but for your family members.
Could you discuss how the vaccine supply situation is going, and will we be getting more soon?
The vaccine supply has been increasing consistently over time. The least consistent as far as supply goes is the Janssen vaccine from Johnson & Johnson. And that is primarily due to the fact that they're opening another manufacturing plant, and once that plant is opened, they'll be able to start producing it in much larger quantities. The great thing about the Janssen vaccine is, you know, it was real life tested against variants, so we know that it is effective against a number of the variants out there, and you only need one shot. And so it you know, doubles the number of people who can be vaccinated in the amount of time that it's taking us now with the 2-dose regimen.
You know, and more providers are offering vaccines now than before, whether it's in a drugstore, or whether it's in a grocery store, or whether it's one of the social service agencies. The range of where you can go to get them, and I know there's some people that sign up everywhere and then they go to one of them and maybe not show up at the other one. So I think we're doing a good job of getting some diversification where you can go to get it.
Will Metro Health start reporting symptoms or side effects from the Johnson & Johnson vaccine?
We will report all adverse events from all vaccine types through the same process that we've used for decades.
Are you monitoring what is happening in the Midwest and whether that surge could come to Texas?
We are. I think the entire U.S. is watching what's happening in the Midwest and really doubling down on getting as many people vaccinated as possible. But, you know, the judge makes a really good point that it's not like we have impermeable membranes that separate Bexar County from the rest of the world. So if it's not the Midwest, it'll be someplace else, which is why we're really, really focused on getting our community as vaccinated as quickly as possible.
You know, it's interesting. Michigan, I think, the governor had originally been pretty cautious about opening things up, but now it's all open, and somebody saying you need to slow it down there and get back to some mandates, but they're not doing that. And if it's spreading there, I mean, logic tells you it could spread in other places too.
On another topic, is there any update on the investigation at the Freeman Coliseum?
Where?
A Freeman investigation.
Oh, I don't know. You know, I was out there Friday, I guess. The Attorney General was there today, took a tour of it. He didn't call a press conference like the governor did, but they say it went very well with him. The allegations that were made, I think HHS is looking into it, and so far, as far as I know, they haven't uncovered anything that was of a real serious nature. But you got to remember, there's 1,700 teenage boys there. We've got them in 2 large rooms, so nobody has any privacy. And something, somebody's going to get out do something wrong probably, but I've not seen any substantial evidence that anything serious has happened there. That didn't mean it hadn't. It means they keep looking at them. When they talk about showers, there is no communal shower. They're all individual showers. So we'll see what the HHS report comes out, because I know they've had a number of different people looking in to see, if there was anything that actually happened. So far, I haven't heard anything.
That's all we have tonight. Thank you.